Dr. Baker and I are here to talk with you about a new residency program and share the information and the excitement that we have and our goals in creating this program.
I'm Japheth Baker. I'm the Associate Program Director for the New Emergency Medicine Program at Magnolia Regional Health Center. I got a wonderful opportunity to get recruited down here about 6 years ago to help build this program for this rural community. The things that probably every medical student or medical resident has seen or heard at some point in their life is pay attention to this one case because you'll never see it again. And there were several times that I've heard that through my career, and many of those things I have seen in this community again. We're large enough to do many things, but we're not so large that we have all of the academic consults and such that you typically would see in a large academic center here. So there are situations where patients have to be transferred out or critical decisions have to be made, and being in a rural community center, that's not very uncommon, and being able to utilize the knowledge base, the types of patients that would present to our facility, the extensive pathology that we have at this facility, I think it's made a very creative, very interesting, and very different type of training program. And I think it's going to be something that suits a vast majority of emergency physicians, especially those that are wanting to train in a rural setting.
The term I've used quite frequently in describing the program is it's very collegial because everybody does work together well as any hospital system I've ever been aware of.
If you're rotating here as an acting intern or doing an addition rotation, or if you're a medical student or a resident at our facility or within our program, you have a good idea in a reasonable time frame of how you're doing, what your process is. We definitely want you to be engaged. We want you to be involved. You can kind of do as much as you want. There's definitely a certain amount that we absolutely do want you to do, but you can do as much as you want on top of that, for sure. So there are many niche areas that if you have an interest in, we can help build, with your help, of course, help build some of those things into our program.
We've, on top of it, largely through Dr. Baker, put together a pretty strong set of didactics that we anticipate should help our residents do very well on in-service exams and on their boards when they finish.